Sigmund Freud. Sigmund Freud was most well known for his development of psychoanalysis. Psychoanalysis is a method through which an analyst unpacks unconscious conflicts based on the free association, dreams, and fantasies of the patient. Freud was born in 1856 in the Czech Republic. As the firstborn of 8 children, his mother was especially fond of Sigmund. She was both passionate and loving toward her children. However, Freud feared his strict father, whom was 20 years older than his mother. These parental relationships of fear for the father and sexual attraction to the mother are what Freud later referred to as the Oedipus complex. The Oedipus complex, which is in reference to the Greek legend of King Oedipus, is the childhood desire to sleep with the mother and to kill the father. In 1873, Freud began his medical education at the University of Vienna. He spent 8 years there because he insisted on taking philosophy classes in addition to his medical curriculum. Freud's medical degree focus was on biology. In fact, he dissected over 400 male eels to determine the structure of the testicles. His findings were that, they were actually inconclusive. During college is when Freud began to use and experiment with cocaine. He claimed to ease his depression and chronic indigestion. He denied using cocaine after college because of criticism, but recent letters have examined and revealed him using the drug at least 10 years after his degree was earned. This was kept a secret until now. In 1881, Freud received his medical degree and established his practice as a clinical neurologist. In 1882, Freud married Martha Bernays and proceeded to have 6 children. One of his children, Anna, became a well-known psychoanalyst as well. Next were his most impactful years on psychology. In 1895, Freud published his first book marking the beginning of psychoanalysis, while the zeitgeist of the time was that Titchener was 28 years old and forming his structural psychology, while functionalism was also beginning to flourish in the United States. In his first book, Studies of Hysteria, written with his colleague Breuer, examined the case of Breuer's patient Anna O. Anna O. suffered from the physical symptoms of hysteria. Freud examined how these physical symptoms are often the surface manifestations of deeply repressed conflicts. This then became the focus of Freud's work. In 1897, at age 41, 2 years later, Freud gave up sex because of his highly negative attitude about it. During this year, as a result, he suffered from neurotic episodes. He had migraine headaches, urinary problems, spastic colon. He even worried about dying. This episode of neurosis led Freud to analyze himself, just as he did with the Oedipus complex. In 1900, Breuer and Freud split ways because Freud decided to refine his argument about the impact of dreams when he published The Interpretation of Dreams. Breuer did not agree with this. An important part of Freud's legacy is the importance of dreams. Dream analysis is a psychotherapeutic technique involving the interpretation of dreams to uncover unconscious conflicts. Another key concept that Freud had was the psyche. This was made up of 3 components: the id, the ego, and the superego. The id stood for instincts or our unconsciousness, while the ego stood for our reality, which satisfies the id in a socially acceptable way, both consciously and unconsciously, and the superego, which is our morality and the responsibility we take for our morals. This is in the conscious. The last key term that Freud had was of free association. This is a psychotherapeutic technique in which a patient says whatever comes to mind. This is the classical picture of a patient lying on the couch talking openly to a therapist about whatever is on their mind. In 1939, Freud died, and psychology had changed dramatically.